প্রথম দেখাই যাচ্ছে যে ছবিটা আমরা দেখতে পাচ্ছি অন দ্য স্ক্রিন, একটা লেবার কি করছে, একটা অ্যাঙ্গেল গ্রাইন্ডার দিয়ে একটা chunk of stone কে grind করার চেষ্টা করছে, and in the process what we are seeing is that there was so much of dust coming out of this machine. Okay, so by this picture we can easily guess the topic of the day. The topic of the day is, obviously, it is silicosis. Fine. So what actually is silicosis? If we go through the definition of silicosis, what we find is that it is a fibrotic lung disease. By the term fibrotic lung disease, many of my students should be familiar with it, because this has already been explained many a times in the class. If there are people viewing this lecture without having any idea of fibrotic lung disease, I'll be requesting those to see some other videos of mine where fibrotic lung disease is discussed in detail. As of now, let us understand that silicosis is a fibrotic lung disease which is attributable to the inhalation of crystalline silica that may be in the form of a quartz, that is the most common form, quartz, and less commonly there are other forms of quartz also, that is cristobalite and fidimine. But all these three forms, quartz, cristobalite and fidimine, are basically silica. Now if we come to the epidemiology of this disease called silicosis, we find that this is an ancient disease that continues to be a major disease worldwide in men and women exposed to silica dust in a variety of occupations. Up to 30 to 50% of workers in primary industries and high-risk sectors may suffer from silicosis and other pneumoconiosis. Now, you pronounce it as pneumoconiosis or pneumoconiosis, that's entirely up to you, whatever you pronounce it as. The concept of pneumoconiosis is beyond the scope of the present lecture, and I shall be preparing a separate video on what pneumoconiosis are. But one complications I should be mentioning here, that is written at the bottom of this, it is the increased incidence of tuberculosis. Exactly, tuberculosis with increasing severity of silicosis. So if people suffer from silicosis more, there is a higher chance that that same people would also suffer from tuberculosis. This kind of tuberculosis is known as silicotuberculosis. Coming now, let us now examine these different causative agents as already defined. This one out here is the quartz that you can see. The next one out here is the tridymite, and the third one is cristobalite. All these three are different crystalline forms of silica, that is silicon dioxide. And silicon dioxide is thus available almost everywhere. You are staying in a building which is made up of concrete. Concrete do also have silica. There are certain medicines that you consume, the packaging of which contains silica. Even certain food additives do also contain silica. So as long as silica are there, what we see, this is of no harm. But when the silica comes in the form of dusts, and when you begin inhaling the dusts, then we tend to develop the problems of silicosis. Let us find out those people who are having a higher risk of suffering from silicosis. Who are they? Let's read one by one. That's the miner, that means who are working in the coal mines or gold mines, whatever the mines be. The driller, tunneler, developer, the driller, hammerer, digger, cutter, dresser, driller, polisher, grinder, mason, molder, knockout man, fettler, core maker, crusher, pulverizer and mixer, workers in the manufacture of abrasives. So in a nutshell, I have summarized it on the last line, that is those workers who are at any stage of process if products are dry. So what is the significance of this line? If products are dry means if they are dry, then obviously there would be dust originating. So the dust would produce the disease of silica. Now, if somebody develops the disease, then what signs and symptoms can be found in that person who is silicotic? That means who has developed silicosis. Let's just find out one by one. The first obviously would be the dyspnea, that is the shortness of breath, and that kind of shortness of breath would be exacerbated by exertion. So if the person tries to walk more, the shortness of breath experienced by the silicotic patient would be more. The next one is cough, and that cough be persistent, and sometimes it becomes very severe. It becomes intolerably severe. Next, obviously, since there is a shortness of breath is directly related to fatigue. So if you breathe less, you would have less amount of oxygen and you would feel more fatigue. The next one is tachypnea. So that is your body's own effort to compensate for the shortness of breath. So you would feel, you would have an urge to breathe in more amount of oxygen, since the oxygen that reaches your blood is less. There is a point out here that is called the loss of appetite and weight loss. Now this point is basically nothing to do with the respiratory system directly. This is a general feature, so I have kept it separate. Coming now to the last, as of now, this symptom that has been seen, that is a chest pain. It develops because of the respiratory disorder only. Then again is a general symptom, that is the fever. And finally, the skin tends to become blue. The skin darkens gradually, becomes blue. Now, all the signs and symptoms are for those people who are not yet in the advanced stage of the disease of silicosis. In the advanced stage, what do you find? Let us have a look one by one. Sinuses and pallor along upper parts of the body. So your skin becomes blue and your skin becomes pale on the upper parts of the body also. Next is an important point, that is cor pulmonale. That actually is a problem of your heart, mainly involving the right ventricle of the heart. And finally, that can cause death, is respiratory insufficiency. So that is a point that needs to be remembered, respiratory insufficiency. Now, let us examine what actually happens in the body as we suffer from silica. This is the view of what happens inside the body. If you see it, you will find the view of a lungs, at the end of which are the alveoli. So you see that the dust particles are entering the alveoli, and it is causing the thickening of the alveolar walls by the production of silicoproteinosis. Here I give you the view and I make you see the different actions of the different particles having different sizes. These are the green particles representing the silica, and this is the change that is produced. I will show you that diagram once more. These are the differently sized particles. The green particles are coarser and the blue are finer. The blue particles represent the silica particles. So the blue particle can reach at the extreme ends of the bronchi, but the green particles, being coarser, cannot reach to that extent. So what happens as the blue particles reaches to the extreme end? The blue particle, observe it that it is reaching the extreme end. This is the consequence. As the blue particles reach the extreme ends, at the extreme end there is the alveolar sacs, so it develops into silicoproteinosis. Not only on the extreme ends, what you find is the development of certain nodules that are all made up of the silica. This nodules are known as the silicotic nodules. So for a medium exposure of for duration of 10 to 20 years, what are the changes? The changes in short are summed as chronic silicosis, which are of two types. One is the simple nodular silicosis. You see the lung appearance is much more different than the lung appearance out here. This appearance is known as the complicated conglomerate silicosis, or PMF, that is the pulmonary massive fibrosis. So this is much more massive form than this one. How does it develop? We shall even have much deeper look into it. Reviewing the previous part of the videos, here is the thing that I want you all to focus. What I am showing you is the alveoli, and this one single cell in red out here is the alveolar epithelial cells. These particles are silica particles that has come into this area and inflamed by causing a direct injury on the alveolar epithelial cells. Next comes the role of the cells that are known as macrophages. So these are the macrophages in blue that you can see on the screen. These are the macrophages which has ingested the silica particles, and the result is the stimulation of so many immunomodulating factors. If you want me to read this out, these are the tissue necrotizing factors, the interleukin-1, fibronectin lipid mediators, oxygen-free radicals, and fibrogenic cytokines. What happens next? Does the macrophage succeed in killing the silica particles? Absolutely no way, because the silica particles are not living, so there is no question of killing the silica particles. The macrophage itself undergoes destruction. What is the next consequence? Here I show you the interaction between the macrophage cell membrane and the silica particle. The another result is the macrophages are all destroyed. With the destruction, the macrophage release certain fibrogenic factors. It does simultaneously also releases the silica particles which are unchanged in the macrophage, and the silica particles are re-ingested by other macrophages. You can now see on the screen is this fibrosed area. Okay, so this green area represents the fibrosis area. So moving further, you see the other changes, macrophages, lymphocytes, and fibroblasts getting involved. Finally, to produce this silicotic nodules out here. Additionally, if you have a look on the trachea and the bronchi, what you find is the green areas. The green areas represents the lymph nodes. Normally, the lymph nodes are not having the shape of an eggshell, but once silicosis develops, what you find is that enlargement. You see the lymph nodes has enlarged. These are known as the highlight lymph nodes, and this is the mediastinal lymph nodes. Both these lymph nodes has enlarged in this view. Additionally, the shape of this individual enlarged lymph nodes becomes similar to the eggshell, and so we use the term eggshell calcification. So this is one of the characteristic finding of the disease of silicosis. So this exactly are the phenomena that goes inside. I was about to show you a picture of pulmonary massive fibrosis. Anyways, there are so many things to know about silicosis. I just give you a short list of the things. If I try to make videos on each and every of these topics, then it would be quite a huge big one, which some of you might find very monotonous to view. So I end the video with a list of the topics that every student should know further. Those topics are the pathology, then the management of silicosis, the pathophysiology of silicosis. I have discussed in part a bit of the pathophysiology, the pathogenesis of silicosis. Next, the most important thing, the different pathological types of silicosis. Obviously, the prevention of silicosis, because silicosis, if once develops, that fibrotic change can never be reversed back. So it's much more necessary to prevent silicosis than to cure silicosis. Finally, the different complications that each person can suffer from silicosis. One complication I've touched here in this video, the name of that complication is silicotuberculosis. There are other complications also. I will be probably making a separate video on the complications of the silicosis. So with that, I complete the video of this day. Thanks for watching. Here I present that number for WhatsApp. You people can text me all your suggestions. You can provide the feedbacks in the comment box of this video. And if you are actually willing to learn more about the common diseases that we all suffer from our day-to-day basis, I would be requesting you to subscribe to this channel so that in future you get immediately notified of the videos once they are released. Thank you. Thanks for watching.